series. I'd like to do that midweek. And then I would like to wrap up towards the end of the week with a community update as well. We've also been working with keeping up-to-date relevant community data on our website, and we have been working with Providence St. Mary's Hospital to get more hospital data, and there have been a few roadblocks. We did receive permission to publish some admission data last week. I believe we started that on Friday, and we're working on trying to get more data. So we are going to keep working on communicating more information to all of you. This is just an example of the videos that we posted on our website last week, and some of the meetings that we've had here, the Department of Health meetings that we've had. So there'll be more to come. With regards to COVID activity in the country, when we spoke last week, 87% of all the counties in the United States were high transmission counties. And now this has increased to 93%. I'm sorry, 93%. And you can see that Nebraska looks a little blue. And I haven't had a chance to research this, but for some reason, Nebraska is not reporting county level data. So that number might be a little bit higher than 93% nationwide. We have shown this graph at previous meetings, and as you recall, a couple of weeks ago, the case rate rise was 33%, and then it declined a little bit to 13%. Our latest case rate rise is 3%, but I don't think we should get complacent that things are slowing down. I'm not convinced that COVID has reached every nook and cranny of our nation, so we'll just have to keep following that closely. We have seen increased hospitalizations nationwide, not quite the peak that we had back in the winter, but there's some interesting text here. The CDC does mention that new admissions of patients with COVID are currently at their highest level since the start of the pandemic for all age groups under the age of 50. So, you know, most people have this sense that it only affects older people, but now we're seeing a lot of younger people having to be admitted to the hospital. The second paragraph here is a little sobering as well, that new admissions in the state of Washington, among others, is the highest that it's ever been since the start of this pandemic. And I'll show a slide of Washington state data here in a minute. We also are continuing to see an increase in deaths throughout the country. Looking at Washington state data, you can see from this slide that, you know, between 92 and 94% of all cases, hospitalizations and deaths between February and around August of 2021, all of those were in unvaccinated people. So it truly is a pandemic of the unvaccinated. We do have concerns about breakthrough cases, and overall, nationwide, we're seeing about 10% of breakthrough cases. However, keep in mind that people with breakthrough cases tend to have milder symptoms, and there's less risk of hospitalization and death. Looking at Washington State the Washington State case rate curve. Also, keep in mind that all this data lags, so these numbers are actually a little bit higher than what's posted on these slides. But as you can see, Washington State has reached a new peak case rate level. As I mentioned earlier, every county in Washington State is a high transmission county. And just perusing the case rates of the 39 counties in Washington State, it looks like about half to 2/3 of the counties have a new high peak case rate. And I'll show you some of these. So we've been looking at some of our neighbors. You know, Benton County has a new peak case rate. Columbia County pretty much eclipsed their highest case rate. Cowlitz County, which is on the western side, pretty dramatic, new peak in case rate. Douglas County, Franklin County, Island County, just showing you a sampling of some of the high case rates throughout the state and how things are dramatically changing all around us. This is Lewis County. Even counties along the I-5 corridor, Pierce County has their new highest peak case rate. Thurston County, same story. So we've been talking about our case rate curve, and it has been relatively flat compared to the other counties. But our case rate is high, but just the rate of acceleration has not been as high as other counties. And again, because of lagging data, our internal case rate is over 800. That's what our calculation is. Over the past couple days to a week, there's been a slight dampening in the number of daily cases, but it's hard to tell if we're reaching a plateau or not. It's going to take a little more time to determine that. This is the ranking of as of as of Sunday that was published from Department of Health. We rank 11th in the state for case rate. Again, this is all lagging data. With regards to hospitalizations, as I mentioned earlier, this Washington State has the highest hospitalization rate that they've seen since the start of the pandemic. And also, as you recall, we've talked over the past several weeks that there was a rise in non-COVID hospitalizations over the spring and early summer. And so the hospital system was basically at capacity even before this increase in case rate and therefore hospitalizations. Hospitalization rate, we are 7th in the state, but again, that's just the hospitalization rate. It doesn't account for staffing issues, and some people think that maybe I'll get sick and maybe I'll have mild symptoms. That doesn't really matter. Why should I get vaccinated? But remember that you can spread it to someone else, and that drives hospitalization. So cases drive hospitalizations. We've mentioned this before.
I have a quick question for you, Dr. K.
Yeah.
Can you go back one? So on the Walla Walla County, is that just our hospitals, and that counts with Umatilla County people sending over, or is that just residents from Walla Walla County? Do you know? I
believe it's just residents of Walla Walla County.
Oh, okay.
I'll have to confirm that, but as you know, and I'll show a slide later, that we do have a percentage of people from out of our county who are hospitalized in our hospital, but this is all part of the referral pattern, and that referral pattern has to be kept intact as best we can, because we also send people out of Walla Walla. But the problem is we're getting to the point, we're probably at the point statewide where there's just no place to put people. I looked at just trying to dig around and get some information, and some of the surrounding areas, some of the reports are that one area, no staffed beds, another catchment area, no staffed beds, another catchment area, no staffed beds. There was a comment about patients being put in conference rooms, canceling of non-urgent surgery. So it's not just Walla Walla, it's the whole package. And so did that answer your question?
It did. Thank you so much.
And so just back to this slide here, this is the Delta variant. People talk about the reproductive number, and before COVID, the original strains, if you got it, you would maybe spread it to 1 or 2 people. Now you have the chance of spreading up to 8 people. And so we've shown this slide before too, but just want to reiterate the fact that the Delta variant is more transmissible and more and potentially more deadly. This is the chart that we have on our website. This is from the hospitalization data from Providence. This little bar here will pop up if you hover over any of these bars. And so this slide shows that this was as of Friday. We're still waiting for information from today's census. But Friday, there were 25 patients in the hospital, and 17 out of the 25 were unvaccinated. You can see that the ICU admissions are 6, and out of that, 4 are unvaccinated. And you can see that on the ventilator, 3 people were admitted, and 2 of those are unvaccinated. So once again, shows the importance of getting vaccinated. This chart here is also on our website, and if you hover over the bars, it kind of tells you the origin by county of where the patients come from. This is a graph of Walla Walla hospitalizations, and it changes by the hour, but we're definitely reaching our peak hospitalization rate for COVID. There's a chance we could surpass that. And it certainly is a dangerous situation just trying to get access to even non-COVID care. And last week I mentioned that the state and the nation is on fire with COVID, and I thought about not using this slide because I thought it was kind of melodramatic, but this is on our doorstep. This is in our house. Our house is on fire. We have the highest case rate statewide that we've seen since the pandemic. We have the highest hospitalization rate since the start of the pandemic. We have limited hospital capacity, and we have the presence of a highly transmissible Delta variant. So, there is a chance to, if we do the right things, we can potentially slow the spread through the house and stop the damage. And we have the tools to stop the damage. We've talked about vaccinations. They're safe, effective, and free. We have continued access through the pharmacies in town, through some of the clinics in town, and through the Southgate Clinic. We're continuing to work on expanding the Southgate Clinic hours. We're still working that out, and we're still working on a few other programs. Masking is vitally important because of the transmissibility of the Delta variant, and likewise social distancing, and also hand washing can be effective. So, the county fair, I am a little nervous about the county fair, but I understand people want to try to live somewhat of a normal life, and this is a situation that if we do it right, it has potential to be a safe event, and people should be cognizant of other people's rights to be safe. So, the governor has a mandate for masking indoors. Those buildings will be marked. But we're also recommending and strongly recommending and requesting that even if you're outside, if you can't socially distance, to mask. There also are going to be a lot of hand washing stations up, and if you can't follow these guidelines, don't go to the fair. We just can't afford a large spike in cases in Walla Walla. Our hospital system is overwhelmed. And just encouraging everyone to be really, really careful at this time and follow the guidelines. And just to finish with just our commitment to improving our communications, and I want to thank some of my colleagues in town for helping with some of the time and legwork and content that it takes to do that. So that's the end of my presentation. Any questions?